My name is Erin Foutch. I'm a registered nurse here at Meritus Medical Center. I've been here since 2001 and I work in the emergency department. Right now we're in the waiting room of the emergency department at Meritus. Last year we saw 72,000 patients. This year we are 3 months into the fiscal year and we're on target for seeing 80,000 if the numbers stay how they've been. The first thing a person should do when arriving by private vehicle through the front door is go to the triage first nurse, and she will ask them briefly why they are here. She will then decide if they can proceed with registration or if they need to go to a bed right away. We don't treat based on time of arrival. We treat based on priority of illness, and we use something called the Emergency Severity Index to determine which patients need to be seen first. Patients who come by ambulance may actually get sent to the waiting room if they're not as sick as someone who's been in the waiting room. We do have seasonal variation. In the summer we tend to see more trauma patients, which makes sense, people riding their ATVs and being active. In the winter we see a lot more influenza type illnesses, respiratory infections. The busiest time of day is usually 10:30 a.m. until 1 a.m. every day. Statistically, our busiest days are Saturday, Sunday, Monday, and Tuesday. Family is welcome to come to the emergency room with their patients. We see them definitely as an asset to the patient's care. They can very often give us information the patient is sometimes unable to give. Sometimes when large groups of family come, though, we will ask at the bedside that family members rotate out just so that they do not impede the care that we are trying to provide. Everything is judged on a case-by-case basis. We understand there are times that child sitting issues are an issue, but we prefer children do not come to the emergency room. There's radiation being used at the bedside. There's equipment, and of course there are a lot of germs. A very common reason during the week patients come to the emergency room is because their primary care physicians are overbooked and can't see them. And on the weekends and evenings when the primary care physician's offices are closed, we'll also see those patients and we also welcome them. There isn't a reason you shouldn't come. However, there are other options for lesser illnesses or injuries in the community. You may decide to go to one of our outpatient urgent care centers and be seen for something more minor, a more minor illness or injury. And we do have a hotline you can call. It's the number is 1-800-274-0499, or you can call into the emergency room and ask the charge nurse.